In this unit, we will go over the muscles of the anterior thigh and the anterior leg. First, in the anterior thigh, we can split the muscles into two main groups or compartments, the first of which is the quadriceps group, and the second is the adductors group. We will begin with the sartorius muscle. This muscle originates from the anterior iliac spine and inserts along the tibial tuberosity. This muscle acts to rotate the thigh and leg. Next, we see the rectus femoris muscle, which originates from the iliac spine and inserts at the base of the patella. This muscle acts to extend the leg and helps in flexion of the thigh. Next, we see the vastus lateralis muscle, medial to that, we see the vastus intermedius muscle, and medial to the vastus intermedius, we see the vastus medialis muscle. The vastus muscles originate from the upper part of the shaft of the femur and insert via the common quadriceps tendon. These muscles act to extend both the leg and knee. Next, we see the tensor fascia lata muscle, which originates from the ilium and the fascia latae and inserts along the iliotibial band of the fascia latae. This muscle assists in flexion and rotation of the thigh. Again, here we see the iliotibial band. Next, we will examine the muscles in the adductor compartment. All of the muscles in this compartment originate along the ischium or pubis of the os coxae and insert along the linea aspera or pectineal line of the femur, except for the first muscle here, the gracilis, which makes up the medialmost muscle of the thigh. The gracilis muscle inserts on the medial shaft of the tibia. All of the muscles in the adductor compartment act individually or synergistically to adduct, flex, and rotate the thigh medially and outward. Next, we see the adductor longus muscle, indicated here. Just superior and lateral to the adductor longus, we see the pectineus muscle. Deep to both the adductor longus and the pectineus muscle, we see the adductor brevis muscle. Superficial to the adductor brevis muscle, we see the obturator nerve. Deep to the adductor longus, on the medial side here, we see the adductor magnus muscle. Notice the size of this muscle compared to the other two adductor muscles. This region is known as the femoral triangle. The medial border of the femoral triangle is the adductor longus muscle. Superior border is the inguinal ligament, and the lateral border is the sartorius muscle. The medialmost structure in the femoral triangle is the femoral vein, shown here. Notice the medial branch off of the femoral vein, the great saphenous vein. Just lateral to that, we see the femoral artery. And lateral to the femoral artery, we see the femoral nerve. Remember that that is vein, artery, and nerve from medial to lateral. Next, we'll take a look at a muscle that is just lateral to the femoral vein, artery, and nerve. That's the iliopsoas muscle shown here. This muscle is a continuation of the psoas major and iliacus muscles and inserts on the lesser trochanter of the femur. Next, we'll take a look at the branches of the femoral artery. First here we see the profunda femoris, first branch off of the femoral artery. Next, off of the profunda femoris, we see the lateral circumflex femoral artery. And then the profunda femoris continues downward. If we flip the femoral artery around, on the medial side we can see the medial circumflex femoral artery. We'll show that one more time. Again, we see the femoral artery. Branching off of that, the profunda femoris. The lateral branch there, the lateral circumflex femoral artery, off of the profunda femoris. Notice that the profunda femoris continues inferiorly and deep into the leg. And again, the medial circumflex femoral artery branching off of the profunda femoris. Now we will move to the muscles and vasculature of the lower leg. Next, we will examine the muscles of the anterior leg, starting from the medialmost muscle and moving laterally. First, we see the tibialis anterior muscle, which originates on the upper tibia and inserts on the medial cuneiform and first metatarsal. This muscle acts to dorsiflect the foot. The extensor digitorum longus muscle is just lateral to the tibialis anterior. This muscle originates from the tibial tuberosity and body of the fibula and inserts on the second and third phalanges. This muscle acts to extend the toes. Deep to those two, we see the extensor hallucis longus muscle. This muscle originates from the front of the fibula and inserts on the terminal phalanx of the hallux. When flexed, this muscle acts to extend the hallux. Lateral to the extensor digitorum is the fibularis longus muscle, which originates from the upper fibula and inserts on the medial cuneiform and first metatarsal. It acts to extend, abduct, and evert the foot. Just deep to the fibularis longus is the fibularis brevis, which originates from the mid portion of the shaft of the fibula and inserts on the base of the fifth metatarsal bone. This muscle also acts to extend, abduct, and evert the foot. Next, we will examine the vasculature as well as innervation of this region, starting with the anterior tibial artery, shown here. Remember, this is a branch off of the popliteal artery. Running parallel with the anterior tibial artery is the deep fibular nerve. Remember that these two structures are found deep to the extensor hallucis longus muscle. Just superficial to the fibularis brevis, we see the superficial fibular nerve. Running along the medial side of the entire length of the leg and thigh is the great saphenous vein, which remember feeds into the femoral vein. That concludes this unit. Next unit we'll go over the muscles and vasculature of the upper limbs.